And good Tuesday afternoon. It is Tuesday, April 4th, just after 2 p.m. And my friend, Mr. Frank Prosich, joins me. Frank, how are you?
I'm doing fine. How are you, Ryan?
I'm doing okay. Important conversation you are going to have today. It's not always the most comfortable or always the most fun, but it's one of the most important conversations we can have.
Yeah, Centers for Disease Control over the last 2 or 3 weeks came out with a couple of surveys, I guess I would call them. One of them showing that 10% of high school kids across this country have attempted suicide. That's a mind-boggling event, and like 42% have emotional issues. It's just not an issue of kids, but it's a serious issue. And we're fortunate this morning to have Kerrie Constant, or I guess it's afternoon.
It is this afternoon.
I keep getting that mixed up.
If anything, you are consistent with saying that during every interview.
I am. Kerrie Constant, she's the area director for the American Foundation for Suicide Prevention. We want to talk to her about how to recognize that somebody might have a problem and where can you get help. Of all the stuff we talk about, that's probably the most important. Hi, Kerrie. I was going to say good morning, but that would be
good afternoon, good morning, good day. How about we do that one?
There we go.
And
thank you for having me here today and bringing up this very important topic.
Well, thank you for coming on.
We'll do this a couple times, but we're going to start off with it because it's the most important thing. If anybody walks away from anything, hopefully Kerrie can agree with this at the end, is this one number. If you or anyone is experiencing a crisis, you can call or text 988. And maybe, Kerrie, we can start right there on that number and the importance of it and why people should know about it.
Yes, absolutely. So in July of 2022, they launched a 3-digit mental health crisis number that the 1-800 number for the suicide hotline is still available, but for suicide and mental health crises, if someone is experiencing that or someone you know is experiencing a mental health crisis, you can dial 988. Much easier to remember a 3-digit number in the moment of crisis. And then on the other end, there are trained crisis counselors who will help guide you through getting support in your mental health crisis.
Where are they located? Is that national, or does it bring you into a local network?
That's great, Frank. Rhode Island is managed through BH Link for our 988. If you're familiar with BH Link, there's a lot of work that we're doing to continue, and with the government too, at the state level, to have 988 available with mobile crisis units. So yes, it is available in the state, and the crisis counselors on the other end are from the Rhode Island area.
Kerrie, maybe you can tell us a little bit about the American Foundation for Suicide Prevention.
Yes, thank you for asking. So the American Foundation for Suicide Prevention is the leading organization for suicide research. And from that research and funding research, we build out a robust catalog of suicide prevention programming to educate the public on how to recognize risks, how to recognize behaviors and address those risks. We also focus on advocacy at the legislative level to support legislation that is smart about mental health and suicide prevention. Matter of fact, tomorrow night for the advocacy, we have our AFSP, is the abbreviation for the American Foundation for Suicide Prevention, Advocacy State Capitol Day. So we'll have volunteer advocates coming together to advocate with our legislation for mental health bills that are on the docket. So that's another area of work that we do within the state. We support loss survivors as well, and really what our mission is to save lives and bring hope to those who have experienced loss or been affected by suicide.
Recent CDC reports certainly showed a crisis among high school kids. It's not just about high school kids. It's about everybody in one way or another. But I also read on the Rhode Island Health Department site that we probably in Rhode Island have among the lowest suicide rates in the country. Is that accurate?
Well, it's per, when you're talking on the rates, you're talking per capita of people as well. So it is lower, but it's still it is the 14th leading cause of death in the state. And one loss of life by suicide is always one too many.
And am I accurate when I say it's the number one condition for loss of life among children?
No, that is not the case. There's different sectors of that. It is the second for ages 16 to 24. And it's it's around, I don't have the numbers right in front of me, but it's around that a little higher for younger ages. But it is a mental health crisis for that particular age. And as you mentioned, the CDC just conducted the Youth Risk Behavior Survey for 2021. So just know that those figures are coming from 2021. And it's also a survey. So it's a sample. And it's a sample of 17,000 students, high school students. So that's, it's a broad statement to say across the United States or a segment. And that's just the preliminary data that's coming out from the CDC. They have not released the full reports yet. So we're also missing the effects on demographics as well in different segments of populations, to be able to kind of dive in a little bit more to see how we would, address the issues. But we are, there has been improvement for students in several areas for adolescent health, but we definitely recognize that mental health and suicide thoughts and behaviors among certain subsets and students are concerning.
Do we have enough? Let me start with this: enough mental health providers in our communities.
Well, health parity and health workforce is an issue that, especially in Rhode Island, and I think last time we talked, Frank, I mentioned this, the Governor's Council on Behavioral Health. It's a big focus that they're looking at and they're addressing. And there's, although AFSP, we're not supporting or advocating behind those bills because that's not our expertise in the workforce, but we do recognize that there is definitely a need for increased mental health behavioral workforce development that needs to be done.
How are we doing on a school level?
So the school is one area of that really can support a child. And in Rhode Island, they did adopt the model framework for suicide prevention. So they are taking steps to make sure that within schools that there is a lens on recognizing the support for mental health for students.
I want to jump into what I think is maybe the most important area, and that's how do individuals recognize that there may be a problem, and what should they do?
Yeah, that's a great question. I think to protect teens, especially teens and tweens, from suicide risk, parents can teach, really model healthy habits and talk about mental health and take care of as important, talk about mental health as it being just as important as physical health, and to be taking care of their own mental health and talking about it openly and seeking support, therapy, and just finding ways to have healthy practices within their home. If a child sees you're approaching your own challenges and learning at how to kind of take care of your own risks and things that are happening, they have a better understanding that it's okay to struggle and learn how to find help and support. The stigma of mental health is, lessening, and to the point that people are talking about it more. And so as we normalize that mental health as important as physical health, if you were to injure yourself, you would get care, right? If you would physically injure yourself. So when you're experiencing symptoms of depression, withdrawal, those are symptoms of of emotional pain, and that should be addressed and talked about. Some of the things that parents can do to support their children is just pay attention to their behavior and their moods, and talk to them, ask them how their day was, listen without judgment, and really trust what they're saying. If they're not feeling like they're not okay, to let them know it's okay to not be okay, and what can we do to help. And it's really a we, not to say and put a stigma of, some families, especially for males, I think it's tough to kind of toughen up, don't act that way, so kind of sweeping it under the rug. Instead really asking children, tell me more about what you're thinking. I love you, and I want to understand. So it's really that open conversation and building those healthy habits that are really going to help, and seeking help as well, and creating that community. So, you asked about schools. So it's parents talking with the schools and coaches, and just their whole 360 environment on how we're just paying attention and modeling behavior.
I think most important, what I heard was we need to trust and listen.
Absolutely.
Two really key elements.
Mm-hmm.
Is there are there any demographics that are more prone to having emotional problems? Probably not, right? It goes right across the spectrum, I would think.
Yeah, there is. I would say that there are different nuances within different populations and cultures. And at American Foundation for Suicide Prevention, we recognize that. And again, through our research and our studies and the work that we do with the communities. So our premier suicide prevention community education program is called Talk Saves Lives. And we offer that. If you go to afsp.org/Rhode Island, we do have public virtual Talk Saves Lives sessions monthly. So anybody can take the sessions to learn risks, behaviors, and what they can do. But we also have them for different populations. So there is a Talk Saves Lives for seniors. There is, because the aging population will face depression and face mental health challenges differently. There's different risk factors that come into play. And it's the same thing for youth. So we have youth programs that can support recognizing the youth population, but also Latinx. So the culture and how the family and the stigmas and the barriers might be different. So we have a Talk Saves Lives for Latinx. We have Soul Shop, which for black churches. So kind of bringing that into the African-American community as well, with those aspects of the nuances of cultures and the barriers and stigmas and risks.
I'm just writing a bunch of notes to myself, but you mentioned a couple of minutes ago that the stigma of mental illness is subsiding somewhat, not totally by any means. What do you think? And I know there's no way to measure it at this point. The fact that Senator Fetterman was so open about his depression and his treatment, how I would assume that has a very positive impact on people being maybe feeling more comfortable about facing or talking about their own situations.
Yeah, I can't speak to just one person, but what I can say is those that are in the public eye, public figures, celebrities, are talking more and advocating for mental health support, and having open conversations to normalize that getting help is a strength and not a weakness. And that also, again, kind of rolling that into our programs that Talk Saves Lives, we have one for workforce as well, because kind of building that culture, not just within your nuclear community, but also the broader community as well in your workplace. So again, it comes down to, Frank, from a parent to a coach to a teacher to someone at work, a celebrity, the president, whoever's talking about it, the more people that talk about the importance of mental health, the more we will lessen that stigma and the more people will reach out to get that support and help that they need.
We talk about the individual who is contemplating suicide, has emotional issues, but it also has a tremendous impact on the people around them, on their families. What kind of support is there for families? And then I would suspect that when somebody attempts suicide or commits suicide, that within that family, there's a tremendous amount of guilt and feeling that they have not done enough to try and help that individual.
Yeah, so each person's experience of struggle of their own and also supporting someone with struggle is different. Again, there's many different factors that come into play, the environment, their mood, their behaviors. So it's really, you talking and supporting is the most important thing. But taking a session like Talk Saves Lives and learning more and educating yourself and being in tune to listening with empathy, compassion, and with no judgment. And if someone does say and be upfront, if you're worried about someone who might be at risk, so talk to them and listen to what they're saying. So if a person talks about killing themselves or feeling hopeless, so if they mention, I feel hopeless, or if they say, I don't have a reason to live, or they feel like they're a burden to others, if they say, I feel like I'm a burden to others, or feeling trapped. So if these are things that you're hearing or behaviors that you're seeing, so if you're seeing things like they're withdrawing, or that maybe they're overly happy because they might have contemplated the decision in their mind and they feel that they're feeling a feeling of, okay, this is how I feel. Or it might be that they're giving possessions away. So again, those behaviors and the actions in their moods, do they seem anxious or overly depressed? So when you see this, you can ask them directly. And I know sometimes people are worried about, if I ask, am I going to put the thought in their mind? But it is a strong point to ask, are you thinking of killing yourself? Are you thinking of taking your life? And then listen. And when you hear the response, if the response is yes, then say, I care about you and I want to help you. Let's get help and work with them to get help and support. And if it's a crisis situation at that time, you can call 988. Or if it's a life-threatening situation at that very moment, then dial 911.
What are some of the resources out in the community for people if they suspect someone is depressed and potentially suicidal, or even for that individual who is feeling that? Where do they turn?
So there's lots of resources in the state of Rhode Island for what I have available at my fingertips for at AFSP. There's afsp.org/support. So you can find counselors or peer-to-peer groups. We also have a program called Finding Hope, which is for those who are supporting someone who might have had a life experience or that's struggling. The Rhode Island Department of Health has resources. BH Link offers resources. There's prevention coalitions across the state and in counties that offer resources as well. So there's a lot of mental health resources available across the state. There's, now I know Newport Mental Health has mobile crisis units that are out and really being able to treat right away. So I think that's one of the barriers we face, is people feeling that when you go, when you need treatment, right? You have an emergency, you think of going to the emergency room. making sure our emergency rooms are equipped with understanding how to connect someone to behavioral health crisis centers and support immediately, because that's important. If someone, there is data around that if someone has if someone has taken their life by suicide, that they had a visit to the emergency room prior.
What if somebody encounters an individual who perhaps may agree that in fact they have some kind of a problem but refuse to get help? Is there a way or a place that somebody can go that can get other help?
Again, it's we're not a crisis. We don't provide services for counseling services. So, but I would say that if someone is in that position where someone's not, keep checking in on them. If it's a moment where you feel like their life is in danger at that moment in time, to call 911.
Kerrie, I believe that your organization goes out and provides programs in the community.
That is correct. Yes.
Can you tell us about those?
So we have our, I mentioned it earlier, Talk Saves Lives. So Talk Saves Lives is a program that identifies the warning signs, talks about the risks, and what you can do to support someone or yourself if you see those warning signs, risks, and behaviors. And that, again, is a public education program, prevention education program that we offer monthly, but we also will come to locations as well. So if there's community centers or places of worship or schools or workplaces that would like for us to come and present Talk Saves Lives, we are available to do that. We are a volunteer organization, so we're always looking to connect and build our volunteer community. We raise funds to expand our research, and we provide support for those who have experienced loss. So we have a day in November called the International Survivors Day of Suicide Loss Day, where we bring those who've experienced loss together for connection and healing. If somebody knows of someone who's experienced a loss by a suicide death, we also will send them support materials. There's a program called Healing Conversations where we can connect them to another peer who has experienced a similar loss, just to talk and let them know they're not alone. It's a one-time conversation, but just to let them know how they have progressed through their healing journey, that they're not alone, and that there's support there for them. There's a community that cares.
Kerrie, I have a question from a reader, and she phrases it a little bit different, so I'm going to let you answer here. And we need a mental health hotline to help prevent individuals from getting to the point of suicide or homicide. So, Karen, I'm reading into your comment without background, but a number to help people from getting to that point. What resources, I guess, I'm a believer in therapy. That's where I look to, but I wonder how you would answer this.
Same again. Thank you, Ryan, for bringing Karen's question up. So again, helping people that's really what we're doing. We are working to stop suicide and creating that prevention ahead of time. So again, learning to recognize the signs, normalizing mental health care, normalizing having therapy, that it's not something you wait until you're in a crisis for, that it's just like going to your annual physical. So if we normalize that more to seek help, AFSP.org has many, many resources on learning how to address the signs. There's different segments on our website that will say, I'm concerned about someone, or I am struggling, or I've experienced a loss. And there's articles and research and connections to the CDC, to the Suicide Prevention Coalition. There's, so all of our, the JED Foundation, lots of different organizations that we collaborate and partner with. But again, I agree. It's kind of getting that support ahead of time. And then I also want to mention 988 isn't just about being in the moment of crisis, but if you're worried or concerned, you can call 988 and they will provide you that support and direct you to where to get help.
Kerrie, if an organization is looking for you to come in and present some kind of a program, how do they do that?
They can go to our website, which is afsp.org/Rhode Island. And my information's there. You can email me or call me. Email's best. You'll get in touch with me much easier through email. And that's KCONSTANT@afsp.org. I'm still new in my position and building out our website, and soon we'll be having a program request form and also materials. So if you have a workplace or a community center where you just want to have, like we have these small little, looks like a business size, that are life-saving manuals that has touch points on recognizing the risks and the behaviors, the warning signs, and how to respond. Or if you want pamphlets out, like those little life-saving guides can be left in a doctor's office, a pediatrician's office, wherever, a community center, a convenience store, and anywhere, anyone can request those items. So, and the same thing with programs. So we have like I said, the Talk Saves Lives. We have
Kerrie, how did you come to the organization?
So I am a longtime nonprofit professional, and through the pandemic, I left a 18-year career. And I was thinking, what else would I, like to do? And I was looking for work with a purpose. I am fortunate I have not experienced a loss of a loved one by suicide, but I have in my family very close support, those who have struggled, and had actually been in a situation where I took a mental health first aid class and started learning the signs. And I went home and asked my son, because he exhibited some of the signs. And I asked him straight out, how are you feeling? And he said he wasn't feeling that well with his mental health. And I said, do you ever think of taking your life? And he said, yes. So I'm very fortunate that we were able to get him help and support. And we had him, and he was safe for that time. And so it's always checking in on him to make sure he's safe. So that's my story of how I'm connected to the mission and the cause.
It's for a mother, it has to be devastating to see that, but from a standpoint that you were able to make that connection and help him, has to be incredibly gratifying.
I feel very fortunate, very, very fortunate.
Kerrie, there's all sorts of great things on the website, which I'll run on the bottom here one more time. Opportunities to volunteer, programs, events, updates, Circle of Hope, how to get help, real stories, anything you could possibly want or need is at that website there, afsp.org. And then you can see the chapter Rhode Island. You can find it there.
We'd love to have people connect to volunteer. The community events are, partially fundraiser, partially bringing the community together. I think that was the most moving thing for me when I started with this organization, in the Out of the Darkness walks that we had, one in Newport and one in Providence, just to see people come together to support each other and let them know that they're not alone, supporting those who have experienced loss, supporting those who are struggling. And our most upcoming events that we have a campus walk coming at Roger Williams University. And we also have a Pause for Prevention. So we know that pets are really important to our mental health. I know my dog is. So Pause for Prevention will be May 20th at the Warwick City Park. We'd love for people to come join us.
I was just going to quick note. I'm on the board of directors for the Potter League for Animals in Middletown, and we also have shelters or clinics throughout the state, please reach out if you ever think of a way we can work together.
Okay, I definitely will, because this is our very first pause for prevention, and this is giving us an opportunity now. One of the things we want to do is really, I'm the first full-time staff person that AFSP has had for Rhode Island, so it's giving us a chance to kind of be a fabric of the community to support be smart about mental health, and really create a close community and let everyone know that we're there for support and we want to collaborate and, stop suicide and fight suicide.
Kerrie, I have actually two questions. First, if somebody's motivated to volunteer, what kind of volunteer opportunities are there? And second, you mentioned bills on the docket in the legislature. I wonder what some of the more prominent ones are.
Great question. So first, on the volunteering question, so there's many ways that you can volunteer. What I'm getting requests continuously now, and we're a small and mighty group right now of volunteers for just spreading the message and letting people know about the cause and how to access support for prevention. And so volunteering as a community ambassador and being able to be at tables and working with me to recognize areas in your community that we can provide resources to. It may even be a funeral home who can give someone who's just experienced a loss by suicide resources. So it's really kind of building that network. I know I think my saying for Rhode Island is the smallest state with the biggest personality. And so there's just so much potential within the state. And I'm one person, so more volunteers would be great for that. You can volunteer to support the walks. You can volunteer for our fundraising. You can become a very easy way is to sign up to become a field advocate. And anytime that legislation comes through that to provide testimony or a letter of support, we have all the resources for you to do that. You don't have to have any prior experience for advocating. We will give you that support. And to that point, Frank, I'll mention the bills. The bills that we're focused on is supporting legislation for 988 and crisis services, architectural bridge barriers, the PTSD, providing support to first responders who are experience PTSD, and prevention education for K to 12. Those are the 4 priority areas that we're supporting in this upcoming legislation.
Kerrie, anything that you would like to add that we may have missed?
Another volunteer opportunity that I forgot. Also, the Talk Saves Lives presentations, again, the more that people know that it's available, we are looking for educator presenters. So it's a module that you're trained on, and then you can we can have that program deployed more in our communities.
I was trying to bring it up, Frank, and I think I finally got it here, but I encourage everybody to go to the website. We can't talk about this forever. Well, I could talk about it forever, but when you go to the website, it talks about the Rhode Island laws and where there's a law in place, encouraged by law, required by law. And I encourage anybody who cares about this to go on here and see, where we do have the greens and where we do have the reds. And I don't see any yellows yet, but you can see kind of where we sit. And if you hit the back button here, you can compare us to other states and things like that. So it's a good place to track kind of where we're putting ourselves against some of our neighbors.
Yeah, absolutely, Ryan. And when you sign up to be a field advocate, you're in the advocacy center, and it'll connect you. As soon as you put your zip code in, it connects you to who your legislators are, what bills they'll be supporting. You can click on Rhode Island, and it'll show you the bills that are coming up in the future. So it's just a good place to kind of get acquainted. You can take Advocacy 101. Again, you don't have, if you are concerned about some of the legislation and bringing legislation for smarter mental health forward, we have Advocacy 101, and we have the support for you as you go along.
The final question I have, and it's gonna be one of the biggest challenges of your organization because people are so stubborn. How do we, and it's not just suicide, but how do we get away from the stigma that you are weak if you ask for help?
It takes everyone. First, it's a personal responsibility to not be afraid to talk about it, right? To be able to say, like, I'm not shy. I say, well, I have my mental health appointment this month, which is with my therapist, and it doesn't mean that I'm experiencing crisis or that I'm depressed. It means it's just a check-in for me, to say I'm doing okay, and that's something I've committed to for myself. So again, it's first taking care of your own mental health. It's kind of that cliche of when you're in the plane, first put your mask on first. Take care of your mental health and model that for those around you, and talk. Sometimes we don't want to. If we're worried about somebody, we may not say something. Ask people, are you okay? Do you need support? Just keep having the conversations. And that's why, we want to bring suicide prevention and mental health support to our schools, to our workplace. You hear more and more workplaces now too, not calling it sick days, but calling it wellness days, right? Because sometimes you just need a mental health wellness day, and that should be normalized, right? To kind of de-stress yourself and take care of your mental health the same way you would your physical health.
One of the great, not joys, but great things. I go to therapy, and I'm proud of it, and I'm happy to talk about it. And when you bring it up to somebody that's also going through it, they just light up like, oh my God, I could talk about it with somebody. You don't have to go in around and pound your chest about it, but sometimes when you open that conversation, people want to tell you about that they're going and what they're experiencing. And it's a great way to connect with people on a different level.
No, I agree. That's what I was saying. Like, instead of saying like I have an appointment and feeling that stigma of like I don't want anybody to know, it's like, well, today I have my mental health appointment, and so I can't do that because this is important to me.
Frank, anything else, my friend?
No, I'm going to add also, as you mentioned, I lost my wife back in July, and I've been going to counseling twice a month, and I'm pretty open about it, and it's just incredibly effective. And to your comment, Kerrie, earlier, one of the first things that the therapist asked is whether I was contemplating suicide, which I was not. But clearly, you asked the question, and there's no shame in going and getting help.
Mm-hmm.
I will tell you that I wouldn't be. It's a rough thing to go through. It would be a lot worse if I didn't get the help.
And sometimes we're talking about that help. It's community and connection as well. So we all went through COVID, which actually brought up more conversations about mental health and that need for human connection and community, to be part of a community. So if somebody is again not connected, connect with them, see how they're doing. Visit friends, visit relatives, make a phone call. Just go to a community center, take that dance class you wanted to take, or or go for a walk and talk to people, say hi to people as you're walking down the Bristol bike path. And it's just it's that connection that kind of helps lift up your mental health as well.
Excellent. Well, Kerrie, we appreciate you taking the time to chat with us today. AFSP.org. chapter, Rhode Island. I'll include it in the story, as well as people can find it on WhatsUpNewp.com, or they can also just Google it as well, American Foundation for Suicide Prevention, Rhode Island, and it will come right up. Most important, keep this number handy. It is equally up there with 911. If someone someone you think, I'd imagine it's okay to possibly be wrong on this, thinking, somebody, I think they need help, and then calling and possibly getting them help. You'd rather be, as they say, safe than sorry. So
yeah, have a plan too. Like, just have people, not just 988, but if you're not okay, who's your person, or who's your circle that you can reach out to, and talk to them about that ahead of time. For one last one is for teens, there's an app called Not Okay. Well, I think it's for anybody, but it's one we talk about in our It's Real program for teens, where they can, they're part of social media, and it's an app that they put 5 people in there that if they're not okay, they can hit the button and say, I'm not okay. And then that way people can start conversations with them through text. So it's coming up with that plan, to keep yourself mentally healthy as well, and know who your supports are and what to do.
Well, we thank you for all of your time and information today, Kerrie. Certainly an important conversation. We thank you for taking the time.
Thank you for having me. Happy to come back anytime.
All righty. That is Kerrie Constant, and we appreciate her taking the time to chat with us today. Important conversation that you brought to us there today, Frank.
Yeah, I think extremely important. I think people would be hard pressed not to know of somebody within their family or friendships who at least would have at some point contemplated suicide. And organizations like Kerrie's and all the stuff that she says saves a lot of lives.
It does. AFSP.org. AFSP.org. All right, Mr. Prosnitz, thank you very much. For anybody who might have jumped in the middle of this conversation, you can watch it, listen to it on WhatsUpNewp.com. It will be available there as a podcast shortly. And you can take the video, you can share it. And it's certainly an important one. So we would appreciate it if you did. So thank you, Mr. Prosnitz.
Thank you, Ryan.
All right. On behalf of Frank Prosnitz, myself, and all of us here at WhatsUpNewp, we want to thank Kerrie for joining us. AFSP.org. Thanks for watching.